What is up, guys? My name is Kaushik, and I'm a third year medical student at the Yonglulin School of Medicine. Here in Singapore, medical school is 5 years long, and I thought of making a video series to document my journey through it and see how I progress along the way. So, in this video, I wanted to sit down and share with you what it was like to be a M3 or third year medical student during the pandemic, which obviously added to the difficulty of being a medical student as if it wasn't hard enough before. I want to give you guys an overview of what the past year felt like and also share with you 3 interesting stories which summed up the whole year for me. So if you're going into M3 or are interested to apply into medical school, you know what to expect, and maybe this can be something that you look forward to. Alright, M3 is the first year of clinical studies. In this year, we finally enter the major leagues and we are thrown into the deep end at the hospitals and clinics. This is after 2 years of spending our time in the minor leagues of lecture theatres and anatomy halls, learning the theoretical aspect of medicine. Now, this was something that I was really looking forward to because I enjoy doing things hands-on and being more practical rather than just reading the textbook. But because of the whole pandemic situation, our time in the hospital had been cut short by half. Don't ask me why, I'm not sure either, and it doesn't quite make sense to me. But yeah, that was the situation, and we spent 50% of the time in the hospital and 50% of the time at home watching Netflix. I'm just kidding. The other 50% was spent on home-based learning, so this was more of lectures and pre-recorded videos for us to supplement the learning in the hospital. I joke with my friends that these few batches of doctors are going to be the half-cooked bunch of doctors because we only got 50% of the whole med school experience. At the hospitals, medical students are attached to the care teams, and as an M3, you are literally at the bottom of the hierarchy of doctors. Obviously, you don't have too many responsibilities when it comes to taking care of patients, but I quickly realized that if you did not take the initiative to be a part of the team, nobody would even realize that you are there, and you could have wasted an entire day at the hospital. At the same time, I also realized that a medical student's input can go a long way in bettering the care of the patient because we have a lot more time on our hands and we can actually spend this time getting to know the patient and their history a lot better. Because of this, how I made use of the time in the wards really mattered a lot in my learning. So to maximize my learning opportunities within the limited time given to us, what I did was go to the hospital a lot more early than usual and talk to the house officers to get interesting patients that I can clerk and learn from. I will then go talk to the patient, take a full detailed history, do a physical examination, and later during ward rounds, present this case to my consultant so that I can get some feedback on how I did. That way, I learned as much as possible when I was in the wards. Not only did this improve my understanding of various conditions, but it also improved my soft skills of talking to patients, as well as learning the medical lingo of communicating with fellow colleagues. M3 is supposedly the most difficult year in medical school because of the sheer volume of content, as well as the steep learning curve of entering the hospital for the first time. We go through 5 postings in M3, which comprises of internal medicine, general surgery, orthopedic surgery, family medicine, community health project, and it concludes with 6 weeks of electives, which is what I'm having right now. All postings are roughly 10 weeks long, adjusted for the study break and holidays in between. So in total, M3 is 56 weeks long, which is actually longer than an entire year. My academic year actually started exactly this time last year, and I still have 4 weeks to go. So how it works is that the entire batch of medical students are split amongst the different postings, and we are rotated through different hospitals, polyclinics, and GP clinics across the island so that we get a good exposure to the different healthcare clusters that exist here in Singapore. The start of each posting feels like joining a new school. It's a new environment, new colleagues, new working styles, new patients, and so on. And because you're being rotated around every 10 weeks or so, you really need to be adaptable and flexible enough to make changes to your lifestyle and the way you work on the go. Outside of studying, I think one of the most important and rewarding things to work on is figuring out your work-life balance. This is the first year of many to come in the hospital setting, and the habits that you build in the first year will stick with you for a very long time. So during M3, I'm glad that I took the time and effort to take good care of my body, mind, and soul so that when I'm in the hospital, I can give it my all and not feel burnt out because of the workload and stuff like that. For the rest of this video, I decided to pick out 3 stories that really stood out to me in the past 1 year. The first of which was my first night shift during my GS posting. I was posted to Ng Teng Fong Hospital, and since this was my first posting, I barely had any idea about how a hospital worked, where the doctors were to be found, or who was part of a health care team. And also, since this was during the circuit breaker period last year, there were a lot of restrictions within the hospitals, and students were not allowed to enter operating theatres or other high-risk facilities. Because of all this confusion, I was already very clueless enough during that posting, and for that particular night shift, I was told to go and find the on-call team. And I thought that the on-call team would just be sitting around and waiting for patients to come at the emergency department at the A&E, just like in the show New Amsterdam, which also happens to be the only show that I've watched about medicine. So that was the only reference I had in my mind, and I really went down to the A&E thinking that that's where I'm going to find the on-call team. When I went to the A&E, everyone over there was so surprised to see a medical student over there. I didn't know that the A&E was a prohibited area for medical students at that point of time. So all of us were pretty stunned and didn't know what to do. Mind you, this was at the height of the pandemic, so all the doctors and nurses were wearing the full PPE, their N95s, the face shield, the gown, and the whole deal, you know. And here I was, a medical student in my scrubs and just my normal cloth mask, looking like a complete idiot over there, and I didn't know what to do. Thankfully, one of the junior doctors came up to me and helped me out to find my way to the on-call team that day, and I eventually managed to link up with them. On hindsight, I thought that was pretty funny, and that experience pretty much sums up how a clueless M3 student would feel in the hospital. Luckily, things got better for me as I spent more time in the hospital, and I didn't find myself getting lost around there as much anymore. The next story is about my first time in an operating theatre. By October of last year, the number of COVID cases had settled down quite a bit, and a lot of the restrictions on medical students had eased. So during my orthopedic posting, I got to scrub in and be a part of my team for one of the surgeries. I have to say that my job during the surgery was awfully important and difficult. As in, I had to stand in one corner and make sure that I didn't contaminate the sterile field or hinder the surgeons during the surgery. Yeah. But at the end of the operation, the chief surgeon called me over to assist with the suction and stitching up of the wound. This felt like a very big milestone in my medical journey thus far, because this was the first time I felt like I was actively responsible for the outcome of a patient. If I had stitched wrongly, the patient would have left with an ugly scar or worse, an infection. Thankfully, none of that happened, or at least that's what I like to tell myself. Moving on to my last story, this was towards the end of year 3 when I was doing my family medicine posting. At the polyclinic, I managed a consultation from start to finish all by myself, starting with taking a history of the patient's presenting complaint, then performing a physical examination on the patient to come up with my list of differential diagnosis, and then sending the patient down for blood tests so as to come up with my definitive diagnosis. And then once that was confirmed, I prescribed the patient with the medications that was required. Although I was supervised every step along the way by a doctor, this was the first time I felt like an actual doctor. It was pretty exciting and has honestly been one of the best days in my medical school thus far. I had really come so far since the start of M3, where I could barely take a full history from a patient. Now, not to get too far ahead of myself, I know this was a pretty simple case of food poisoning, and obviously my training as a doctor has a long way to go. But this was definitely reassurance that I was on the right path. Alright, these 3 stories hold a special place in my journey in medical school thus far. And I'm really excited and curious to see how the next 2 years pan out for me. I hope you got a thing or two from this video, and if you enjoyed this video, it would really mean a lot if you could hit the like button so that I know that you enjoy this kind of content. And if you would like to see more such medicine related content, do hit the subscribe button because I'll be posting more videos about my journey in medical school. It's not going to cost you anything, so you can unsubscribe at any point if you don't like what I'm making. And to the incoming M3s, all the best for the rest of the year, and I hope to see you guys around in the wards. Cheers, and till next time, it's Kaushik. Alright.